Due to the fact that our spring training has once again been canceled, these awards were presented at the town hall sessions that just took place April 4th and 5th. It is our intention that these awards will be presented each spring during face-to-face training sessions and in front of a group of peers. The Stork Award is presented to a paramedic crew that delivered a baby. A midwife or family member is on scene, delivery has not yet taken place, and a paramedic crew assists in the delivery. Please note, if the baby has already been delivered and the crew transports, this does not meet the criteria. 2021 recipients. On the afternoon of March 22, 2021 at 15:19, both 5305 and 5254 crews were dispatched priority 4 to a 22-year-old female in active labor with the urge to push. The Wiki PRU arrived first, assessed and made the mother comfortable. Her water broke just prior to the arrival of the transporting crew. Once the transporting crew arrived, all three paramedics initiated transport. The crew worked together assisting the mother with delivery, and at 15:59 a baby girl was born with an APGAR score of 5, which improved dramatically to a 10 5 minutes later. We are pleased to present this award to paramedics Chris Cooper, Don Simmons, and Jeanette Fox. On October 16, 2021 at 10:40, both 5305 and 5228 crews were dispatched to a 30-year-old female in active labor. The PRU arrived first, assessed the patient, and made her comfortable until the transporting crew arrived. The transporting crew arrived from Little Current, care was continued, and transportation initiated. At 11:28, the baby girl was delivered with an APGAR score of 9, which improved to 10 5 minutes later. We are pleased to present this award to paramedics Chris Purdy, Rod Steele, and Jacob Steele. 2022 recipients. In the early morning hours of March 15, 2022, 5254 crew was dispatched priority 3 to a 29-year-old female in active labor with an urge to push. The crew ensured the mother was comfortable and prepared for imminent delivery. At 03:02, the baby boy was delivered with an APGAR score of 10. We are pleased to present this award to paramedics Cynthia Pelche and Devin Deschamps. On the evening of March 28, 2022, 5271 crew was dispatched priority 3 to a 38-year-old female in active labor. Parents had chosen a home birth and the midwife was en route but not yet arrived. The mother's water broke and the crew assisted her to the bathtub for the water birth. Once the midwife arrived on scene, she requested the crew remain to assist with the delivery. At 21:27, a baby girl was delivered. We are pleased to present this award to paramedics Aaron Wright and Sarah Williams. In the early morning hours of April 21, 2022, 5203 crew was dispatched to Chapleau General Hospital for the transportation of a 28-year-old female in active labor, dilated 3 centimeters, and scheduled for delivery the next day at TDH. Chapleau General provided an RN for transport. At 02:10, while en route to TDH, the baby boy was delivered with an APGAR score of 7, 5 minutes later improving to an APGAR score of 8. We are pleased to present this award to paramedics Melanie Laramie and Ike Scheidel. The Field Save Award. The Field Save Award is presented to a paramedic crew who successfully resuscitate a person with the use of a defibrillator, AED, or CPR. At time of transfer of care at the receiving facility, the patient has maintained vitals. 2021 recipients. In the early morning of October 8, 2021, the crew was dispatched code 4 to a 48-year-old female experiencing chest pain. While the crew was conducting their initial assessment, the patient exhibited seizure-like activity and became VSA. They attached the cardiac monitor, applied defibrillation pads, and the rhythm interpretation revealed ventricular fibrillation. One shock was delivered before the ROSC was received. We are pleased to present this award to paramedics Clayton Courtney and Dan Faulkner. (2022) recipients. On the evening of March 9, 2022, the crew was dispatched Code 4 to a 61-year-old female VSA with CPR in progress. The crew arrived, took over CPR, then applied cardiac monitor defibrillation pads. Rhythm interpretation revealed ventricular fibrillation. One shock was delivered before the ROSC was received. We are pleased to present this award to paramedics Michael St. Amour, Peter Finley, and Matthew Nicholson. On the afternoon of June 18, 2022, the crew was dispatched Priority 4 to a 44-year-old male experiencing chest pain radiating to his left arm. As the crew was assessing him, he became unresponsive. The crew acted quickly, started CPR, and applied the cardiac monitor defibrillation pads. Rhythm interpretation revealed ventricular fibrillation, and a total of 2 shocks were delivered before the ROSC was received. We are pleased to present this award to paramedics Andre Terrier, Brianna Shandera, and Superintendent Lisa Sege. The Paramedic Excellence Award is presented to paramedics who have shown continued commitment to excellence and are high performers in their profession. These areas include, but are not limited to, exceptional attendance, always meeting deadlines for professional qualifications and educational modules, volunteering for community public relation events, employer committees, and immersing themselves in mentorship. They must not have received any discipline and be in good standing with Base Hospital. 2021 recipients, we are pleased to present this award to paramedics Dan Tremblay, Sherry Chopra, Jennifer Hamilton, and Audrey Jones. 2022 recipients, we are pleased to present this award to paramedics Chris Bentley, Chloe Bilodeau, Sarah Williams, and Zach Tremblay. There are 2 memorial awards. The first one is the Adam McDonald Service Award. The Adam McDonald Service Award is presented to the staff member for community volunteerism and dedication to the promotion and advancement of Manitoulin Sudbury paramedic services. For 2021, we are pleased to present this award to Catherine Harvey. For 2022, we are pleased to present this award to Darren Asinaway. Paul Zilio Service Award. The Paul Zilio Award is presented to the staff member who demonstrates a positive attitude, exemplary performance, and who exceeds expectations of both the service and his or her peers in the performance of their duties. We are pleased to present this award to Monique Rochelle-Shaw. Congratulations to all the recipients.